Welcome to the Deep Dive, your shortcut to being well-informed. So imagine your internal thermostat is just suddenly broken, right? And your body's solution is to trigger this massive, sweat-inducing panic alarm.
Which is an incredibly intense, purely biological reality for so many navigating the menopause transition.
Exactly. And usually when we talk about managing those symptoms, the conversation starts and ends with hormone replacement therapy, or HRT.
Right, but what if HRT isn't an option for you? Or what if you're just looking for, something more?
That is exactly the mission of today's deep dive. We are asking a really surprising question. Can a talking therapy, specifically cognitive behavioral therapy, or CBT, actually manage intensely physical menopausal symptoms?
I mean, we're talking about hot flushes, night sweats, severe anxiety, and insomnia.
Yeah, it sounds a bit counterintuitive at first, but we are pulling from a really robust stack of evidence today. We've got the 2024 National Institute for Health and Care Excellence Guidelines, the NICE guidelines.
Plus clinical data from the British Menopause Society.
Right, and the groundbreaking Minos trials. So if you think CBT is just lying on a couch talking about your childhood, get ready for some major aha moments about the mind-body connection.
Well, before we look at the clinical results, we really need to understand the mechanism here. Because, like you said, why would a psychological therapy be prescribed for a purely hormonal physical symptom?
Yeah, let's unpack this, because the hormone drop is very real.
It is. During the menopause transition, fluctuating estrogen levels effectively narrow your brain's tolerance for temperature changes. It's an area in the hypothalamus.
So the thermostat gets super sensitive.
Exactly. The body reacts to even tiny temperature changes by triggering a hot flush just to cool down. But here is where the psychological layer comes in.
Okay.
When a flush happens, it's sudden and highly visible. So many women immediately experience catastrophic thinking. Things like, everyone is looking at me, or I look completely unprofessional.
Oh, or just, I can't cope with this right now.
Right. And that anxious thinking triggers a totally real physical stress response. Your sympathetic nervous system fires up, you get palpitations, an increased heart rate, muscle tension.
Wait, which would actually make you feel hotter.
Right, precisely. That stress response actually intensifies and prolongs the hot flush. You get trapped in this mind-body loop.
So it's kind of like a sensitive car alarm. The hormone drop makes the alarm overly sensitive to the wind, but panicking and kicking the car tire just makes the alarm blare louder.
That is a perfect analogy. You are just adding fuel to the fire.
But wait, I have to push back here, because historically, women's physical pain has often been brushed off. Isn't offering a psychological therapy for a hot flush dangerously close to telling women their physical symptoms are all in their head?
That is such an important point. But what's fascinating here is that menopause-specific CBT completely validates the physical reality of the symptom.
Okay, so it's not saying the hot flush is imaginary.
Not at all. And it doesn't claim to cure the estrogen drop either. Instead, it targets that secondary stress response we just talked about.
Ah, the panic layer.
Exactly.
Right.
By reducing the anxiety surrounding the flush, it actually widens the body's threshold for flushing. It physically reduces the severity of the symptom because you aren't flooding your system with adrenaline.
Wow. Okay, so that's the theory, which makes sense. But let's look at the hard clinical evidence, because we need to know if this actually works in the real world.
And it does. The data is incredibly strong, especially for those who need it most. Let's look at the Minos 1 trial, which was published in The Lancet Oncology.
Right, and this trial focused specifically on breast cancer survivors, didn't it?
It did. These are women who often suffer really severe hot flushes due to chemotherapy, tamoxifen, or ovarian suppression. But they absolutely cannot take HRT for safety reasons. It could stimulate cancer growth.
So they really have no other standard medical options.
Exactly. So the researchers put them through just 6 weeks of group CBT. And the trial showed it significantly reduced the problem rating of their hot flushes and night sweats.
Just 6 weeks. That's amazing. Did the benefits actually last?
Yeah, they lasted at least 6 months post-treatment. And then Minos 2 came along and showed similar success for the general population of peri- and postmenopausal women.
So it works regardless of your age, your BMI, or your specific menopausal status.
Right. And Minos 4 even proved that trained breath care nurses could deliver this therapy effectively. It doesn't have to be a specialized psychologist. The patients in that group saw a 46% reduction in hot flush problem ratings.
Okay, here's where it gets really interesting to me. I was looking at the data, and the actual physical number of hot flushes didn't necessarily drop all the way to 0. So why did the women report feeling so much better?
Well, this gets to the crucial psychological difference between symptom occurrence and symptom distress.
Okay, break that down for me.
Through CBT, the cognitive appraisal of the symptom totally changes. Instead of distress and panic, the women learned calm acceptance.
So the flush still happens, but the freak out doesn't.
Exactly. It breaks the cycle of embarrassment and avoidance. A hot flush goes from being a crisis that ruins your day to just a temporary, neutral physical sensation. And that drastically improves overall quality of life.
That makes total sense. But hot flushes are mostly daytime disruptors. At night, they trigger a completely different and honestly devastating beast, which is chronic insomnia.
Oh, absolutely. Sleep disruption plagues anywhere from 40 to 90% of women in the menopause transition.
Right, so how does CBT tackle that? Because it's one thing to stay calm in a meeting, but it's another to be staring at the ceiling at 3 a.m.
So while the hormonal shifts and the night sweats are the initial clutter that wakes you up, the insomnia itself very quickly becomes a learned behavior.
Right, your brain actually learns how to not sleep.
Sadly, yes. Think about the behaviors we do when we can't sleep. Lying awake, worrying about tomorrow, looking at the clock, maybe sleeping in on weekends to catch up, or staring at our phones.
Oh, I mean, we've all done the nighttime math. If I fall asleep right now, I can still get 4 hours.
Exactly. And all of those behaviors unintentionally train your brain to associate your bed with stress and wakefulness instead of rest.
So to use our earlier analogy, the hormonal night sweat is just the match that starts the fire. But our behavioral reaction, like agonizing in bed over lack of sleep, is the gasoline that keeps the insomnia burning for years.
That is exactly it. And this is why CBTI, which is cognitive behavioral therapy for insomnia, is the medical gold standard for this.
How does that work in practice? Is it just more talking?
No, it's a very structured 6 to 8 week program, and it uses specific behavioral techniques. One of the main ones is stimulus control,
Okay, meaning what exactly?
meaning you only use the bed for sleep and intimacy. If you are awake in bed for more than 20 minutes, you have to get up, go to another room, read a boring book under dim light, and don't go back until you're actually sleepy.
Oh, wow, that sounds tough when you're exhausted. But I guess you're trying to break that anxiety association with the mattress.
Exactly. And the other major tool is sleep restriction. You essentially consolidate your sleep by temporarily restricting the hours you spend in bed to match the hours you're actually sleeping.
Right, which builds up your body's natural sleep drive so you fall asleep faster. It's so much better than sleeping pills.
It really is. Sleeping pills just mask the symptoms and carry dependency risks. If we connect this to the bigger picture, CBTI fixes the actual sleep architecture long term. It gives you the tools to put out the fire yourself.
That is so empowering. It doesn't stop the hot flash, but it completely stops the insomnia that develops around it.
Exactly.
Okay, so given this overwhelming evidence for both the daytime symptoms and the insomnia, how is the medical community responding? Because this seems huge.
It is huge. The 2024 update to the NICE's guidelines actually made a landmark recommendation.
Oh, really? What did they say?
They stated that menopause-specific CBT should be considered for vasomotor symptoms, sleep problems, and depressive symptoms.
Wow, so it's right there in the official medical guidelines.
Yes, and it can be used alongside HRT or as a completely standalone alternative.
Okay, so what does this all mean for the listener right now? Because we know wait lists for therapists can be incredibly long. Is this just great science that no one can actually access?
That is the reality of healthcare access, unfortunately. But the NICE's guidelines specifically suggest self-help options and digital therapeutics. You don't necessarily need weekly in-person sessions.
What kind of self-help options are we talking about?
Well, there are practical tools you can start using right away. One is called paced breathing. It's slow, stomach-focused breathing. You drop your shoulders, and it helps you literally ride out the flush by keeping the nervous system calm.
And the other one is cognitive reframing, right?
Yes. Shifting your thoughts from, this is entirely out of control, I'm dying, to, okay, this is just a flush, it will pass soon.
And what about the digital side?
There are evidence-based tools created by the Manos researchers themselves, like the self-help book, Managing Hot Flushes and Night Sweats. And for insomnia, there are digital CBTI platforms like Sleepio or Somrist.
That's incredibly practical, but are there any catches? Like, does it wear off?
There is a caveat from recent studies. While a brief 4-session intervention works brilliantly, the benefits can sometimes wane after 3 months.
Ah, so you can't just do it once and be cured forever.
Right. It's a skill. Practice and booster sessions are essential for long-term relief. You have to keep applying the tools.
So to bring all these threads together, CBT for menopause isn't just some nice-to-have wellness tip or a placebo.
No, not at all.
It is a rigorously tested, guideline-recommended medical intervention. It actually alters the physiological and psychological experience of menopause, and it offers a completely safe, empowering alternative for those who can't, or just choose not to, take HRT.
It truly puts the control back in the patient's hands.
Exactly. So whether you are navigating the menopause transition yourself, supporting a loved one, or if you're just fascinated by the mechanics of the human body, this deep dive really proves that you are not powerless against biological changes. You have an active role in how your body experiences symptoms.
That's a complete paradigm shift.
It really is. Which leaves us with a final thought to ponder. If a brief, structured psychological intervention like CBT can successfully alter the physical distress of something as deeply biological and hormonal as menopause, what other purely physical milestones or discomforts of aging might we be able to transform simply by changing the way our minds react to them? Something to think about. Thanks for joining us on this deep dive.